Brandy, it's good to have you. Welcome.
Hi, thank you.
My first question before we get into what's happening at your labs and specifically is, could the U.S. do testing much more quickly for everybody if we had a lot more capacity? I mean, are you constrained by how much you can physically process every day?
Yes, we have several constraints. The two biggest ones are supply chain and then staffing. And staffing has become a really big issue, especially here recently. The supply chain has been there since the beginning, and we've had issues with that, but really the staffing has become the biggest hurdle for us to overcome.
And so we mentioned this, but you guys have about 50 positions open. So let's put this in context. That's about 30% of your positions are open, and you think 20% of your workforce is going to retire in the next few years?
Correct. We actually have staff that have retired and come back and have rejoined our workforce during COVID to help with the situation that we're dealing with right now. We even have one manager that has been here for 45 years that has retired and come back because we're under such a severe workforce shortage.
I know that you yourself got into this not necessarily as your first career. So what needs to be done to get more people in? I mean, obviously the easiest thing is to raise pay, to raise wages. You know, are you having to do that? And do you expect that in order to pull people into this industry, that's going to be one consequence?
Well, there's two big things. One, raising pay obviously would help attract more people to it, but a lot of people don't even know that we exist. Laboratory testing is more in the basement, and when most people go to their doctor, they see nurses, they see doctors, they see their pharmacists, but they don't really see the laboratory professionals in the background. So there's a lot of people that do not know that you can't just get a biology degree necessarily and go work in a medical laboratory in a hospital. It's actually a specialized degree, either medical laboratory science or clinical laboratory science, depending on the school. And the problem is that since people don't know that we really exist, people aren't really going into the field. We've had a lot of people not going into the field, and as a consequence, a lot of the schools have closed, having some issues with funding as well.
Wow. What happens with people in terms of the medical checks they need to pass in order to work in these labs in general? You know, what happens if they have pre-existing medical conditions? I mean, what are sort of the standards there, generally speaking?
So as far as pre-existing, you know, we try to not put someone who has a pre-existing lung condition right there doing COVID testing. But as far as the rest of the testing, it's perfectly fine. Unfortunately, we also have such a severe shortage that we have to put people where we can. We're very heavily reliant on traveler technologists right now and medical laboratory scientists. And even with that, it is still having staff that are pulling double shifts just to get the testing necessary for our patients.
Yeah, well, it's definitely put a spotlight on this part of the medical field and how much it could help all of us if you guys had more bandwidth right now. Brandy, thanks for joining us and for everything that you've been doing.
Thank you.
Shepard Smith here. Thanks for watching CNBC on YouTube.